The topic to be discussed is C-reactive protein. We commonly call this as CRP. For reminding points about CRP, keep in your mind a sequence A, B, C. A goes for acute phase reactants. Acute phase reactants means whenever there is inflammation taking place in our body, significant changes are produced in the level of these acute phase reactants. The level can increase or decrease during an inflammation. If the level of acute phase reactants increases, then that is called as positive acute phase reactants. If the level decreases, then those reactants are called as negative acute phase reactants, right? And few examples I have discussed here for positive acute phase reactants: CRP, fibrinogen, ferritin, and for negative acute phase reactants, albumin and transferrin. There are further more examples, but I have discussed only few. Okay, CRP comes under it increases during inflammation. Understood? Now, in ABC, A is gone. Now, for B, it comes under beta globulin family, right? And for C, very important point, it gets its name CRP from this carbohydrate antigen. In pneumococcus, there is an antigen called as C carbohydrate antigen. CRP, this protein has ability to precipitate with this C carbohydrate antigen. But you should not confuse that. Whenever something binds with an antigen, we may think it as an antibody. But CRP is not an antibody. It just precipitates with this C carbohydrate antigen, right? And next point is it is non-specific. Inflammatory conditions. It is not that it is produced in only certain conditions and all that. Whenever in any inflammatory condition is caused, CRP, it increases. Following an injury or inflammation, the CRP level will vary like this. At the first sixth hour, okay, inflammation is caused. Within 6 hours, there will be increase. The normal CRP level is 0.2 milligrams per deciliter. Here I have said that it doubles in every 8 hours. It means that after 8 hours, it will be zero point 0.4. After next 8 hours, which means after 16 hours, it will be zero point 0.8. Like it doubles, right? It will double like this. This is the pattern, right? It doubles every 8 hours. And at 48th hour, it reaches its peak. Okay? Let's see in detail. As I said, normal level of CRP is 0.2 milligrams per deciliter and it increases several folds in every acute inflammatory conditions. Let's discuss conditions in detail. First, there will be insignificant increase if normal value is 0.2. If it is more than 1 milligram per deciliter, it is insignificant increase and this increase is caused in heavy exercise, common cold and pregnancy conditions, right? Then moderate increase, the value is 1 to 10 milligram per deciliter in conditions like bronchitis, cystitis, malignancies, MI, pancreatitis, right? And then there will be marked increase. It means it's a too much increase, okay? More than 10 milligram per deciliter in acute bacterial infections, major traumas, systemic vasculitis, right? That's it. For more videos, comment out if you have any doubts or if you want any topics to be discussed in further videos. Okay, and subscribe to the channel. Thank you.